This is how we come up with cures and treatments for diseases. This is what we have to do. So I hope people will want to participate just like I have.
She cared for countless sick patients, but never got COVID herself.
A High Point nurse is now taking part in a study to figure out why. Fox 8's Tess Barjaber is live in the newsroom with details on this study investigating people who avoided the illness throughout the pandemic.
Well, you might remember Bevan Strickland. She's taking part in a long-term study with Rockefeller University. She's already sent in a saliva swab and spoken with researchers by Zoom. I first met Bevan when she worked long hours in the epicenter of the COVID outbreak in Queens back in 2020. She waited for the moment that she would test positive for the virus, but it never came.
I was very dramatically exposed when I took care of patients in Queens during the initial outbreak. Had droplets on my face, took off my mask a lot so that patients could see my face and not be scared and allow us to take care of them and not fight us. And so I know I was exposed.
Exposure without infection. Nurse anesthetist Bevan Strickland is now among the minority of people who have not gotten COVID. She's also tested negative for antibodies.
I just couldn't believe it. I was like, that's impossible. I mean, I must have something in my body.
The High Point mother of 3 avoided illness again after another close contact.
And then I have twin sons. One of them got COVID. His brother and I were around him in a very close living quarters, and we didn't get it. And this was before they were able to get vaccinated.
Bevan is one of more than 700 people enrolled in a study about genetic makeup and COVID through Rockefeller University. Novant Health's chief epidemiology officer says some people are genetically more predisposed to resisting infection.
I think the key for researchers is to look at, on the molecular level, a very small microscopic level, how does the virus interact with the cells in that person's body? And if it interacts not very effectively, what is it about those cells that prevents the virus from getting in? And how can that information then be translated to therapies or preventative efforts?
I mean, the kind of work that is involved in this kind of research is overwhelming to even think of. So I'm really glad that we have people out there that can do this and that want to do it.
Bevan feels it's a small sacrifice and a way to keep caring for others.
If I can do anything to help, just donate my saliva to help come up with something that what a great thing.
And another interesting note, Bevan told me she and her 2 sons are vaccinated, but only her son who contracted the virus had an immunoresponse to the shot. A spokesperson for Rockefeller University tells me researchers are also assessing about 5,000 more people who reached out to take part in the study. Katie?